Hello, good evening everyone.
Hello. Hi, welcome to our Facebook Live again. Here I am Dr. Jun and with
I'm Dr. Melissa from Revix Clinic Eco Sanctuary here.
Yes. So today our topic is a very common issue.
Yet important topic actually, which
Yes.
affects almost every teenagers and even adults.
Yes. Yeah. So some still struggle with it as an adult and some even have scar left behind with them and affecting their confidence. Yes. So today, so our topic for today is about
Acne and also acne scars. Yes.
So throughout this life, we will go through what is how is acne really formed and what type of patient is high risk with scar and how to treat it effectively.
Yes, from inner and also from outer treatments as well to target scars more effectively. Yes. Okay, so let's start with our live session today. So I believe most of the people out there will think that acne will only affect the school-going children or the teenagers, like primary school, 12 years old and above, or even secondary school. But the fact is, acne can also affect the adults who are more than 20 years old. Because here in Revix Clinic, actually we are seeing patients with acne from 20 years plus, 30 year plus, and even 40 year plus. And those with acne after 20 years old are actually, we name it as the adult acne. Yes. Okay, so what's the difference between these two? So first is the age difference. Less than 20 years old is actually normal acne vulgaris, more than 20 years old adult acne. And also the reason behind them are actually different. For teenager acne, it's actually due to hormones such as androgens, okay, that actually make our oil gland in the skin enlarge. That's why more oil are secreted and our skin become more oily and more prone to become inflamed, and that leads to acne. Whereas in adults, it's actually due to hormones as well, but it's mostly related to menstrual fluctuations as well as sleep deprivation that can actually affect our sex hormone binding globulin that will cause adult acne. So today we will actually digest this more in detail into these two different aspects.
Yes. So maybe first of all, we just briefly go through how is acne formed so everyone can have a very brief idea. Yes. So basically, there are four essential factors that cause acne formation. So firstly is the oil production. Yeah. So our body, what is the things that mainly stimulate our sebaceous gland and cause the oil production is the androgen. Yeah. So when our free androgen in our body is high, then our sebaceous gland will be stimulated more easily and produce more oil gland. Yeah. And another thing also, the androgen hormone not only activate the sebaceous gland, it can also cause our the uppermost skin layer to be shaded not as normal as before and easily to build out that skin there and easily cause the pores to be clogged. Yeah. So when the pores has a lot of oil inside and it's clogged, then it become a good environment for the skin bacteria
to grow.
Yes, to grow inside. Yes. So and this bacteria will multiply inside and also feed on this oil and then release some irritants, fatty acid. Yes. Then in turn it will cause the inflammation under the skin and all these factors when combined together it cause acne. Either is inflamed or not inflamed. Yes.
Okay.
So maybe Dr. Melissa, what are the type of acne lesion that we usually see?
Okay, so why we have to know about the types of acne first? Because we have to differentiate which are the severe forms or the severe lesions that we have to target more effectively, okay? And which are the lesions which are milder, which can just be treated with facial or some creams. Okay, so there are mainly two different types of acne lesions, so which can be classified into inflamed or non-inflamed. So the inflamed one, we will discuss it after this. We will first focus on the non-inflamed one, which are more common actually. So as what you all know or heard about, the non-inflamed lesions are actually the whiteheads or the blackheads that we always talk about. Okay, so first we'll discuss on the blackheads. As you can see from the picture on the right hand side, okay, there is a small black dots on the skin. Okay, that is actually not dirt. It's actually oxidized oil that has clogged the pore of the skin. So this is actually a classical picture of the blackheads, or we call it as the open comedon. Okay, and the second type is actually the whiteheads, which has no pore on top. Okay, which you can see on the second picture, which is the topmost picture where there is the nose. Okay, so the whiteheads are actually skin colored lesion or small dots on the skin. So it's actually we say whitish bump on the skin that it has higher chance to become inflamed or red if we go and squeeze it or we go and manipulate it. So the whiteheads are those with a higher risk of becoming inflamed. So these are the two common ones which are milder, okay, which can be actually settled with just facial or creams. Okay. Next we move on to the more severe one, which are the inflammatory or those which are associated with redness, swelling over the face. So first we can see that they are actually the next picture on the right hand side, okay, or the 2 o'clock is actually the papule. Okay, papule are small red bumps on the skin which has two pus on top. Sorry.
Yes. So it will be appear as a small red color bump, and usually it's tender. Yeah, and usually it's formed over the upper layer until the upper layer of our second skin layer. Yeah, and another one, the fourth acne lesion that we can see on our 8 o'clock is the pustule. So it's also a small inflamed lesion, but with pus formation inside. Yeah, it's collected with the pus. Then the fifth one is the nodule, which is at the 6 o'clock. So it's a larger and deeper lesion, and it has a higher chances of developing scar in compared to the other type of like non-inflammatory acne lesion and also papule and pus. And the last one is the cyst. Cyst will be the multiple collection of the papules that form a larger and deeper tender soft and also fluctuation acne lesion. This is also in a very high risk of forming the scars.
Yes. Okay. So as what Dr. Jis has helped me to mention, so those pustules, nodules, and also cysts are actually higher risk of becoming scar. So we have to treat them more aggressively. Yeah. Okay. So what are the triggering factors that can make the acne worse actually? Why some people they have flawless skin while the others have acne filled face? So what are the triggering factors actually? Yeah.
Yes. So we can see from the slide here, there's a few contributing factors that get the acne to become more apparent in some people. The first one we can see is the genetic reason. So when your family have the tendency to develop acne or scar, acne scar, then you will have the higher chance to get acne.
Oh, so that
as
means
well.
if my sisters or my parents they have very bad acne during their teenage life, I will also have them.
Yes, because their
Okay.
skin have the genetic kind of the skin can and the sebaceous gland can get inflamed and get the sebaceous gland activity is more active.
More active.
Yes.
No wonder some of my patients they actually bring their brothers or sisters come. They have the same common acne problem, so it actually runs in the family.
Yes.
Okay.
So the second one will be puberty.
Mm.
So as we like what Dr. Melissa explained in the previous slide is during puberty, that's the time when we are growing, so our androgen hormone will be spiked as well.
Yes.
So when the hormone is spiked in our body, then it has free
More free
free
androgens.
level
Yes.
of androgen circulating our body and in turn stimulate our sebaceous gland and causing acne. Yes. And other things is like hormonal changes. Like in women we can usually see like we tends to get acne especially during the perimenstrual or during the menstruation
Yes, that's correct.
period. Why is this so? Is because there's a change in the hormone level, which is the progesterone and also the estrogen. So, like during perimenstruation period, our progesterone will be increased. Then this progesterone will also increase the sebaceous gland activity and cause more oil production. And also because of the low estrogen during the perimenstruation period and also menstruation period, then it has a relatively higher androgen level in our body, so that causes
Acne breakout.
acne breakout. So other thing is like stress and lack of sleep. Yeah. So when we are stressed or lack of sleep, then our body will tend to build up cortisol level. So this cortisol will also in turn affect our sebaceous gland activity. Yes. Diet is like high dairy diet and also high sugar diet. Yeah. So this kind of diet will cause like inflammation in our body and cause a high insulin level, insulin spike, and this will also affect the
Androgen level, which actually promotes
also
oil production again. Yeah, so just to add on the hormones part, actually besides the premenstrual, menopausal women or even pregnancy women, and also PCOS women, the polycystic ovarian syndrome, those having this state of condition, they also have higher risks of developing acne due to the hormonal change. Yes. So besides hormone, genetics, we have also sleep and also diet wise, right? How about skincare?
Yeah, so like in skincare, when we use too harsh product or like over cleaning,
use a lot of scrubs.
yeah, use of scrub.
Okay.
How is this so? How is this can form acne formation? Is when we overly clean our face, then it will disrupt our skin barrier. So when our skin barrier is disrupted, and it can get irritated more easily. Yeah, and also in turn it can also like have a negative feedback that causing more oil production from our body. So with the irritant skin and also the negative feedback of oil production, then this will contribute to the acne formation as well. Yes.
Okay, so we must choose the correct skincare products for oily skin as well.
Don't overuse it. Just use the right product and also right frequency.
Means less creamy, less oily
Yes.
product, less scrubbing, no over cleansing.
Yes.
Okay, great. Okay, so besides all the factors that Dr. Jun has mentioned, there are other inner factors which I'll elaborate more in detail, which is actually related to the SHBG. So what is SHBG? It's actually the sex hormone binding globulin, which is a protein produced by our liver. So this protein is actually very important in our body because it binds the sex hormones. So the problem here in acne is actually because of low SHBG. That means the body has less protein. So causing this cause more free hormones or free androgens. So these more free androgens will actually cause more stimulation of the oil gland. That's why stimulate more acne formation. So what are the factors in our body that can contribute to low SHBG? So first of all, the most common one is actually insulin resistance. That is actually found in obese people or slightly overweight people or those with type 2 diabetes. Okay, as well as PCOS and also those with chronic high cortisol level such as Cushing syndrome. Yes. Okay, because high insulin in our body can actually suppress this protein. Okay, thereby causing more free androgens, subsequently causing more acne or more oil on our skin. Okay, so that's the first about insulin. And the second one is about high androgen state. As we all know, polycystic ovarian syndrome is actually related to a high androgen state where we have higher free androgen levels. So again, this will cause low SHBG and cause more oil production and then more acne formation. Okay, so besides these two more common one, we have also low estrogen level during what Dr. Jun has mentioned, the premenstrual, menstruation, and also menopause state. And the next more common one is actually the low thyroid or the suboptimal thyroid level. Because thyroid hormones, they normally increase our SHBG. So in suboptimal thyroid hormone level, it actually causes the SHBG to be low. Therefore, again, more free androgen levels and more stimulation of oil glands. And lastly, of course, is the factory problem. So SHBG is made by the liver. So any issue with the liver due to alcoholism or cirrhosis or fatty liver can also cause low SHBG. So these are the other contributing factors that we doctors actually see when we see our patients overweight, okay, a lot of acne, okay, insulin resistance or hypothyroid state coming in with acne. Yes. So Dr. Jun, so after we have talked about acne, now maybe we move on to the more serious talk on scars that everyone is concerned about because this is what a lot of teenagers they are shy about but they don't dare to ask because they thought it's part of the process, don't have to treat, but it's actually we can treat them. Okay, so yes, Dr. Jun.
So when a patient come into us to consult about acne, so we need to other than evaluate the type of acne lesion, then we need to also the type of acne lesion and also the history of how long they have been having this acne, and from history taking we could possible know that what is the contributing factor. Then this will help us also to know what is the risk of developing scar in each patient, and why is the assessment of the risk of scar is so important is because when we because first one is about the cause. Okay, so if we able to treat the acne earlier,
Yes.
can how to say can predict what is the risk of scar. Okay, then we can give the most proper treatment to them. Yes, and if let's say the scar already formed, then this will need more
sessions,
intervention,
yes, more intervention,
more than other than medication, which include the devices, energy-based devices, and also like injectable, then this will
add on to the cost.
Yes. Then other than the cost, and also of course is to prevent the scar. So when we see if the patient has like papules or nodules, then we know that we need to treat it more aggressively, maybe with some
injections.
Yeah. So then with the proper treatment, then it can reduce the
risk of scarring.
Yes, development of scar. Yes. So and third is to choose the right treatment. Okay. So everyone with acne, the need of treatment is not the same. Yeah. So let's say for some non-inflammatory acne, most probably they will just need some cream. Yeah. Then for like inflammatory acne lesion, then they will need more aggressive treatment. Yes.
Okay, so in summary, scar assessment is very important. So we doctors, besides treating acne, we also do scar risk assessment so that we can help patients to save the cost firstly, and also we can prevent more scars formation. And thirdly, we can actually choose a combination approach or the right treatment for patients. Yes. Okay. So I think most of the people out there, they just know what are acne and what are scars. Actually, we also look at what kind of acne actually will have more or higher risk of scarring. So let's dissect them more in detail. So here in the slide, you can see that there are 8 factors or 8 patterns of acne which has higher risk of scarring. So first of all is deep, large inflamed nodules or cysts. That means the acne nodule is very large, very deep, or even with pus. So this kind of acne have to be careful because higher risk of forming scar. Yes. So don't squeeze it, don't manually manipulate it because it can form scar very easily. If you squeeze it and then there is infection, then the sequelae will be very bad. Okay, so the second one will be widespread lesion that merge together. That means there are many small lesions that actually they coalesce together. So this kind of acne, because when they merge together, they form a large area over the skin. So this can leave on scar as well due to the large coverage area. Yes. And then the third one is actually a very common, which is the same area on the face, which has the acne coming on and off again and again. That means recurrent or persistent acne at the same area, especially at the temple area, the jawline area. So these areas are highly related to scar formation. So if you have acne occurring at the same spot again and again, it can actually will have higher risk of scar. Okay. Then the fourth one is actually why we always advise our patient not to do it. That is manually picking or squeezing the acne. Okay, so because this can leave on scar. That's why we have a lot of patients going to the beauty salon for facial or any kind of pills. Okay, which are actually not advisable because manual squeezing and also picking of the wound can actually promote scarring. Yes, so don't do that even at home or at any salon. Yes.
So what are the other 4 type of acne that can scar easily? Is okay when there's someone with delayed treatment, when they have a long-standing acne and didn't go for any treatment before. This is because when there is like long-standing acne that is not treated before, there is a recurrent inflammation in the skin. Then this inflammation will cause more scarring. Yeah. Then the next one is the location of the acne, especially over the temple, cheek, and also jawline. Why is this area form scar more easily? Is because there's less fat tissue underlying the skin. So if when the scar form, it will form like fibrous tissue which is hardened. So without sufficient fat support underneath it, then the skin that is inflamed and fibrous will tend to pull down the skin and causing the scar there. Yes. So and the next one is genetic. So if someone in family, when you see your family have the higher tendency of developing scar, then most likely also you will also have the scar after getting acne. Then the last one is the acne globata, which is the severe form of acne where there is multiple acne pustule formation come together and forming sinuses in between them. So there is more inflammation there, and hence it causes a higher chance of scarring.
So these are the 8 factors that actually will have high risk of scarring. So first is the large nodule, second is the large area, third is the recurrent, and then fourth is the genetic, fifth is the severe kind of acne, the conglobata, and then sixth is the mechanical squeezing or breaking, and then next is the location at the temple, jawline, and the cheeks, and lastly is the delayed treatment. Yes, okay, because of the prolonged inflammation happening. Yes. Okay. So now let's move on to what are the types of acne scars. So acne scar, when we say acne scar, it's not as easy as what we just name it, acne scar. There are actually different types of acne scars, which we can broadly classify them into sunken, okay, or raised scar. So let's talk about sunken scars. So sunken scars are actually more common than raised scars. Okay, sunken scars are those with volume loss. So in the slide you can see there are 3 main types of sunken scars. So the first one is actually ice pick scars. So ice pick scar, as illustrated there, is actually like a V shape, or we say it's like a narrow, deep scar, but on superficial you see small holes or puncture marks. It's like a large pores when you see on top, but it's actually a scars produced from the previous acne lesions. So you can see in the pictures as shown in the slide. So it's a V shape if you see from the side. Okay, that's ice pick scar, which is actually the most challenging of all scars. Yes. And the next one is the boxcar scars, which is actually like a square shape or a box shape if you see from the side. Okay. And lastly is the rolling scar. It's like a wavy, or we say it's like a semicircle shape from the side. So it's normally caused by chronic, what Dr. Jun mentioned, chronic inflammation due to delayed treatment or due to deep nodules sitting over there. Then we go and break it or squeeze it, then it can form this kind of rolling scars. Yes, so maybe Dr. Jun, what are the other types of scars that you want to tell us about?
Yes. So apart from the atrophic scar, the sunken scars, there is also like raised scar in acne, although it's rare. Yes, but it does happen as well. So the raised scar is what commonly known is the hypertrophic or keloid scar. Yeah, so both of them are raised lesion, raised scar. Yeah, just the difference of hypertrophic and keloid scar is the raised lesion is stay within the original affected area. Okay, then the keloid is it grow beyond extent the original area. This is because of the excess collagen production, deposition in the skin and form the red scar there. Yes, and this tend to seen in people with a genetic of keloid. There is a keloid
genetic
formation
tendency,
tendency genetic.
Yes.
Yes. Then other than the sunken scar and also red scar, there is also another type of scar is post-inflammatory hyperpigmentation. This is not really a scar, but it's the black marks that are left behind because of the inflammation from the acne. Yes, it is tend to see more seen in black, the darker skin type of patients. Yeah, so after talking about different type of scar, so yes, so different type of scar there is
different approach.
type approach
Yes,
of
different approach.
treatment.
That's why we have to differentiate first what are the types of scars.
Yes.
It is marks, it's sunken scar, or it's red scar, and only we can decide or we can suggest what are the suitable treatments for the patients. Yes. So not all acne scars are the same. That's why different scars, different approach. So if we want to treat the scars effectively, we must first understand first what are the scar types. So first of all, we can look at the simplest one, that is actually the PIH or the black marks. So PIH or black marks is more direct treatment. You can either use whitening cream, which you can actually apply it every day at home. Okay, normally whitening creams will contain ingredients like retinoids, azelaic acid, niacinamide, or even vitamin C that will help our skin to regenerate and also brighten up faster. So it will help with the marks. And of course, laser is another approach which can help with the black marks faster. Okay, so these are the two available treatments for marks. Yes, lasers and also whitening creams. Yes. So Dr. Jun, how about keloid scar?
Keloid.
It's actually quite common among the patients that we see. Keloid is actually quite common. So how to treat?
Yeah, so keloid, because it's a red scar, so of course we need to shrink. Shrink the lesion. So how we do it is usually we will inject steroid. Small volume of steroid depending on the size of the scar. Small volume intralesionally, just inside the scar.
Inside the scar.
Okay. Then usually the scar will slowly shrink flatten within 4 to 6 weeks. And by that time we will follow up with the patient again and see how is the size of the scar and to see whether we need to top up the injection again or not. Yes.
Okay. So for marks, for keloid scars, the treatment approach are more direct. Okay. However, for sunken scars, it's actually more complicated. Okay, because they are volume loss and it's more challenging. So the sunken scars, as what we have discussed, they are ice pick, rolling, and also box scar. So the key is actually not just focus on one treatment, but more of a combination treatment. So always combination treatment, unlike the marks or the keloid scar. Okay, so here at Revix Clinic, we actually focus on two secrets of scar treatment. That is the first one, the timing of scar treatment. So we intervene or we advise patient to start scar treatment as early as possible, because as we have discussed earlier, early intervention will have better results and is more cost effective. It helps patients to save on the cost of the money. Okay, so the earlier we intervene, the better the results that we get. Okay, and also number two is the depth. So different scars actually sit at different depths of the skin. So, for example, if the scar is very deep or very sunken, we say, so we can't actually just rely on superficial treatments to fix it. We have to combine a different, more aggressive approach to actually treat those very deep scars. So we actually focus and we assess scars based on these two. Yes. So Dr. Jun, maybe you can tell us more on to what are the principles. Yes.
So to treat the scar more effectively and to get the best outcome, we usually divide it to two phases of scar treatment. So the first phase will be the scar softening treatment. This is because we need to first soften scar first because when scar form is usually very hard, very tight. So we need to soften it first. So we need to break down all the fibrous tissue that stick together. Yeah, it can be done by like substitution or like energy-based devices to soften it. Yeah, so to let the scar is not that visible. Yeah. Then after the scar softening phases, then to get even more better result, more softer skin, then we can go for the scar refinement phase. Yes. So scar refinement phase is we need to polish the skin surface. Polish the skin surface and to even out the irregularity. This can be done with laser or like injectable such as like filler, soft filler, and also even like collagen stimulator. Yeah, and to improve our skin quality as well.
Okay, so there are two phases, softening and refinement. Okay, so just now we talked about combination treatment. Okay, so for combination treatment, we can actually divide into three big categories, which are actually lasers, microneedling, and also injectables. Okay, so maybe Dr. Jun can tell us more on lasers.
Sure. So the first one will be the laser. Is one of the energy-based devices. So the usual devices that we use to treat scar is like CO2 laser and also pico laser. So this laser will focus on resurfacing and also to stimulate our skin collagen and based on the scar depth. Yes. So CO2 laser is ablation laser that it is accurate control small micro injury lesion to help our skin to stimulate new collagen and for healing, and also it can even out the irregularity. Yeah, and hence to help to lift up the depressed scar. Yes, so it can be used in like box scar lesion and also like some rolling scar. Yes. So the next one, another type of laser will be the pico laser. So pico laser uses the it send out deliver the energy in a very short, extremely short burst energy to help to reduce the pigmentation, fade out the pigmentation, and also can help to stimulate the collagen and also the elastin production formations. Yeah. So and these effect together, it can help to improve the skin brightness and also the skin texture as well. Yeah.
So how about microneedling?
Microneedling, yes. So microneedling, we have a manual one and also the one we combine with some technology like radio frequency. Okay, so the first one is the manual microneedling. It can help with the mild to moderate superficial scar and can help for skin rejuvenation mentioned as well. Yes, because when we do the microneedling, it can help to stimulate the collagen as well and soften out the skin texture. Yes. So for radio frequency microneedling is the microneedling. It can create a small puncture with the very tiny needle and combined with the radio frequency energy. It not only can help to stimulate the collagen, it can also help to tighten up the skin tissue as well. Yeah, so it can be helpful in the like some rolling scar or some box scar as well.
Okay, so definitely the radio frequency microneedling is a better choice because it has additional radio frequency that stimulates collagen. Okay. Okay, so here at Revix, actually, we emphasize our special kind of skills that is actually true injectables, okay, which improve the skin quality. So besides the scar, which we also improve on the skin hydration, the pore size. Okay, so first of all, for those very sunken scar like box scar and also the rolling scars, we use subcision. So subcision is actually a technique that we use a large bore needle to actually subside the fibrotic band that is pulling the scars down. That's why you can see the volume loss. So in subcision, we combine with fillers as well. So while doing subcision, breaking down the fibrous scar, we inject fillers to actually build up the volume so that the scars or the skin quality will actually become better. Okay, so besides filler, we also have other injectable types, okay, such as the polynucleotides, okay, which has a very good healing powers. So no matter it's redness or it's scarring, it can actually help. And then the other one is actually collagen stimulator, like PDLA, PLLA ingredients that will stimulate our own collagen to grow and thus improving the scar condition. And lastly is actually amino acid. Okay, so as we all know, amino acids are the building blocks of protein and which later on will form collagen. So by injecting amino acid, which is the basic building blocks into our skin, it actually directs our skin to make more collagen as well. And it's a natural source of nutrients for our skin, so it will help with scarring. So besides filler, we have polynucleotides, amino acids, and also collagen stimulators available. So in our clinic to help with your scarring. Yes.
So in summary, the scar not every
Not all scars.
not all scar require the same treatment, and not one treatment can
Fits
fit
all.
all scar. So we need to evaluate and assess the scar properly and to choose the right treatment to get the best result for the patient. And yes. So so this this will be our slide for today.
So for today, so we have talked about acne and then different types of acne lesions, what are the factors that trigger acne breakouts, and also what are the different types of scars, different types of scar treatment, okay, and how to actually do combination treatment for sunken scars. Okay, so if you have any questions, do drop your questions at the comment box below, and then we are more than happy to assist you with the questions. And don't forget, we have actually lucky draws. Okay,
Yes.
if you ask questions, and then you might be one of the lucky winners. Yes, that we will announce it later on. Okay. So maybe I share on a case that I had, last year, uh, which was actually a 12, 12-year-old girl.
12 years old.
Yes, so she just completed her standard 6 and going to secondary school. So she actually started her treatment at our clinic even earlier at 11 years old. And then subsequently, because her acne was very severe, after starting the medications and also the skincare, we actually advise her to start on scar treatment as early as possible. And she actually followed and she started her scar treatment during the second month of her visit. Okay, and after about 3 sessions of laser and also 3 sessions of microneedling treatment, we can see massive improvement in her skin quality in terms of the skin redness, the skin inflammation all settled down. And because of early intervention, actually now her skin is almost flawless. Yes, because of the early intervention. That's why here we actually emphasize on the timing. So don't wait until your scars has become hardened or form already. Then we have to actually suggest for more sessions of treatment, or we have to do more aggressive treatment, which involve injectables even. Because that girl, actually, she just did machine-based or energy-based devices without any injectables. We can even see very good results with that. Yes. So it helps her to save a lot of cost as well, and the parents are very happy. She is very happy. Yes.
So need to intervene early.
Yes.
Don't wait until it becomes worse. Yes.
And lasers are actually safe for children even more than 12 years old. Okay, it's safe for them. So don't worry, because lasers, it has no radiation.
Yes.
Okay, so it helps to improve the skin quality, and it's very safe for children, for adults as well. So any questions?
Is there any question? Okay. Okay, so there is the first question here. Okay, is it possible to treat the acne scar that been there for more than 10 years?
Okay, then let me answer this. Okay, so if you have been having the scar for more than 10 years, yes, we can actually treat them. Of course, because of the late or delayed treatment, we have to do more aggressively. More sessions of treatments are required, and then more frequent treatments are actually required as well. Yes, so more aggressive, more sessions, more frequent. Yes.
So another question from the same person. Okay, is there any downtime for the scar treatment? Yeah, yes. There will be some downtime from the treatment like laser, like CO2 laser or even pico laser or microneedling, RF microneedling, and even injectable. So the most common downtime that we can see is like some mouth swelling or erythema, from the treatment itself, but it will usually resolve within 3 to 5 days. Yes.
Okay, so the next one is from Cheryl. So thank you for your question. So doctor, if I don't want to do any injectables and just using laser will help with the scar? Okay, so go back to the basic or the case that I've shared. So it depends on the severity of your scar actually, and also the timing when you decided to do the scar treatment. So if your scar is those very severe atrophic or sunken ones, and you actually wanted to start your scar treatment after it has been formed, so of course injectables has to come in, okay, because as we say, more aggressive protocol has to come in. But however, on the other side, if your scar severity is not so severe and you actually intervene earlier, you might not need injectables like the patient that I shared just now. Yes.
So next question is, okay, how do we know that we have PCOS? Yes, so PCOS is very much relatable with like high androgen state and also like insulin resistant. So other than acne formation, the other common symptoms that we can see in women with PCOS is like menstrual irregularity, yes, and also like excessive hair growth, more than other people. Then there's also if or like radiologically you can have a check with an ultrasound to scan your ovaries as well.
And also, that person might be overweight,
Yes,
slightly obese.
Yes.
Yes. So that actually reflects on the insulin resistance.
Yes.
Okay, so the next question from Shireen, thank you. Okay, doctor, after laser, can I go out as usual? Can under the sun? Okay, so Shireen, after laser, you can go out as usual. Okay, however, avoid strong sunlight. For example, going out to the beach or go surfing. You still can go under the sun to pick up your daughter from the school. Okay, but make sure you wear sunscreen because after laser, your skin actually is more sensitive than usual and it can become dry, peeling, and more sensitive to sun. Okay, so make sure you apply at least SPF 50 sunscreen, and if possible, you can wear a hat even when going under the sun. But avoid going picnic by the beach. Okay, so you still can go out as usual. Okay.
So the next question is CO2 laser and pico laser. How do I know which is better? Okay, so CO2 laser and pico laser, it depends on what type of scar and also whether you are on any like isotretinoid. Yeah, because that one can also affect the choose the type of treatment that we choose. So CO2 laser can target like box scar and rolling scar, and if let's say you just already you're not on any like isotretinoid or just at the beginning of this medication, so yeah, we can use this laser to help to soften up your scar. And for pico laser, it's a milder form of laser. It can be used on like scar with hyperpigmentation, the black mark scar, because it can help to fade the pigmentation. And some shallow scar also it will benefit as well. And it can be used to treat the scar at any time of the acne treatment or scar treatment. So Cheryl. So how long do I have to wait to go to the beach or under the sun?
Okay, so Cheryl, thank you for your question. Okay, so you can actually resume back your normal activities, even going to the beach or picnic, after your skin has recovered. So as what Dr. Chu mentioned, there is actually downtime after laser. So the laser downtime will actually last for about 1 week, averagely. So when your skin has completely recovered, that means no more redness, no more dryness, no more swelling, okay, then you can actually resume back your routine activities, even go to the beach. Yes.
Is there any more questions?
So thank you all for your questions today, for your active participation. Okay.
Yes.
So So I hope today's sessions of acne and also acne scars treatment actually benefit all of you. If you have any friends or family members facing the same problem, acne or acne scars, feel free to actually consult us. Okay, because early intervention is the key. Okay,
Yes.
don't wait until it's too late. Because I have patients coming in saying that they thought that acne is normal. It's a normal phase of life that we don't have to treat it. We just have to let it be, use skincare, and then let it form scar, and then nothing can be done. Okay, so it can actually be treated as early as possible, which can give good outcome.
Yes. Okay. So if you have any concern with this, feel free to drop us the message, yeah, or give us a call. Okay. So our next live will be on the 10th of September. So yes. So
The same time?
Yes.
Yes.
So we will see you guys at that time.
Okay, so thank you so much for joining us today.
Thank you.
Yeah, we hope you now understand acne and also acne scars better. Okay, and can help to spread this knowledge and information to anyone who is facing the problem. Yes. Okay. Thank you.
Thank you.